if you're very interested in how to improve your stroke survivors' chances of recovery, and specifically how to improve neuroplasticity in their brains, then the next few minutes in this video is going to be very beneficial for you. Hi there, I'm Dr. Monaghan. I'm a university lecturer, I'm a neuroplasticity expert, and I'm the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about trying to develop a patient and caregiver's home as an ideal place for them to carry out their physical rehabilitation after they've had a stroke. Now, of course, the recovery of your stroke survivor, the physical recovery of it, is very dependent on them developing neuroplasticity, creating new pathways in their brain. It's as simple as that. And so what I'm asking in Lights, Mirrors, Actions is that a very simple program that's designed for your stroke survivor, that it's agreed between caregiver and stroke survivor that you will attempt to do the program for at least 4 weeks. 4 weeks is a decent chance to see which of the therapies you feel work well with you and which therapies that you're not so keen on. Now, an important starting point between you as a caregiver and your stroke survivor is to discuss what goals you want to achieve when you're doing a home rehabilitation program. And some of the goals, so to sit down with a piece of paper and to talk to your stroke survivor and say, look, at what are you trying to achieve here? What are you trying to hope to gain? What are the benefits you hope to get out of a program? So it's discussed and even have it written down between the two of you. So it's very easy to see. And those goals can be to maximize neuroplasticity. It can be to reduce the risk of a reoccurrence of a stroke. It might be reducing fatigue. It can be to try and increase range of motion in your arms and in your legs, and also to increase the strength in your arms and legs. It may be to reduce the pain that you feel currently in your arms and your legs, maybe to improve sensation that has been lost, which often happens after stroke, and even just simply to improve your decision making and make it your business to become more active in the program that you're undertaking. All of these things are very important to keep you motivated and keep you going for the length of time that will probably give you the best results. Now, as a caregiver, to improve neuroplasticity, it's very important you explain to your stroke survivor the concept of the 10,000 hours rule that Malcolm Gladwell discusses in Outliers. I mentioned this in a later chapter, in the neuroplasticity chapter, but I also mentioned as one of the starting points for me, and that motivated me to write this book, was the idea that some of the principles of repetitive practice and the secrets of success that are applied to elite athletes and to business people could also be applied to stroke rehabilitation. So the idea that if you do 10,000 hours of meaningful practice, you can become an expert in any area. We apply that to the idea that if you do 10,000 repetitions, you're going to give yourself the best chance of recovery. So just explaining that to your stroke survivor is very, very important. Now, also explain it to your stroke survivor that what you believe and what they believe in their brains really influences how well their recovery is with their treatments. So in chapter 6 of Lights, Mirrors, Action, we discussed the famous milkshake experiment. And the milkshake experiment is very simple in that, two groups of students were given two different types of milkshake. One they were told that it was very high in calories. One, they were told it was very low in calories. And what they found was the students who believed that they were drinking a very high calorie milkshake, they produced 3 times less hunger hormone the rest of the day than the people who believed it was a low calorie one. And this is phenomenal because it means that a person's brain created physiologically hormones and chemicals in the body based on what the person believed. It's the same milkshake, by the way, on both sides. So I'm going to show you throughout the book ways that you can explain to your stroke survivor that, what they expect to happen. If they expect good things to come, then good things will result. If they expect bad things to happen, then bad things will result. And how to explain that and when to explain that is so important for you at home. The final innovative aspect of Lights, Mirrors, Actions is actually to do with the sequencing of therapies. And you'll see in chapters 19 and 20 the different programs that are actually recommended. It's the sequencing of them that is important. So lights, mirrors, action model is very much based on the idea that lights stands for therapies that wake up or kind of initiate or warm up the body. And we always talk about walking as being one of those things. Stretching can also be involved as well. Um, Mirrors in the lights mirrors action model stands for innovative therapies that create neuroplasticity in the brain and give the brain a greater chance to to become excitable, so that when ordinary therapies are done, ordinary movements and tasks, daily living tasks are tried, the person should get a better benefit from doing those. And then finally, actions within that model stands for the person then after their formal therapy, where their brain has been activated and energized with these innovative therapies, the person then attempts to try and do ordinary tasks around their home, ordinary grasping tasks with their hands, ordinary lifting of the feet and moving and standing, those tasks. So that, and it's my belief based on solid evidence that I've read over the last 30 years, that this maximizes the chances of the person getting a good recovery. So, to increase neuroplasticity, and this is the message that comes from this video very much, you need to discuss the goals that you're hoping to achieve with your stroke survivor. Make sure that they understand that repetitive practice is very much the UK, Irish, American guidelines now, that repetitive exercises certainly gives you the best chance of physical recovery. If your mindset is very positive and you believe that you will have a positive effect on what you're doing, and we show you techniques for how to do that with a little bit of priming, and that's discussed in chapter 18 of the book, then positive things happen and your body's environment is created in a positive way to allow the maximum chance of neuroplasticity occurring. And then finally, the sequencing of therapies is done consciously in a certain way to maximize the chances that they can create neuroplasticity and allow the body to gain a physical recovery. So if you'd like some more information and a little bit of more resources to back up chapter 1 of this book and to assist with the information that we've discussed, then go to my website, which is www.lightsmirrorsaction.com. And there you'll find extra resources, extra workbooks, extra YouTube videos that backs up everything that we've just discussed. Thank you again for buying Lights Mirrors Action. I hope and I know that you'll find it very beneficial to give you confidence and give you guidance when you're working with your stroke survivor. Thank you very, very much.